Good afternoon. Thank you for joining us today. I know there's a lot of vacations, graduations, and holidays, and we appreciate you taking the time to be here with us this afternoon. We're going to give a couple of minutes for everybody that will be joining to have an opportunity to join this meeting this afternoon. But in the interest of time, I will start with some background information. And if Parker, if you could go to the next slide. So I'm going to give, just give a brief overview of the Central Repository. As you know, we do have a wealth of resources that we have multiple specimens and data types that are across clinical and emerging modalities. We support over 250 studies. Many of our studies have provided data that are available for request, and many have specimens that are available for request. This comes out to be more than 11,000 data sets and more than 60 million specimens, including the T1D collections. We have many services and features. Our repository is domain specific. It's a controlled access. We are cloud-based environment, and we provide well-characterized and expertly curated data that are available in common data file formats. We also have a data challenge management platform and an analytics workbench that meets strict security standards. We have other services such as code generation and server data and specimens that you can select for your projects. And all of this is and cannot be accessible if you cannot get into the platform itself. So today in our office hours, we're going to be speaking specifically about the RAS access system and how, troubleshooting some of those concerns. Next slide. This forms part of our secondary data science and Meet the Expert webinar series, which we have as part of our data challenge and series, where we aim to accelerate data science and AI-driven biomedical research, which helps us collaborate between biomedical researchers and experts in the field. Every month, we bring an expert from the field that gives us insights into different topics. This month's seminar is strictly or exclusively on the RAS access management. And the next time we will be speaking on the analytics workbench tools and provide a bit of a demonstration. If you can please join us on June 24th, and that's going to be held between 3 and 4 Eastern Time. Next slide. I'm going to present the experts for today. I'm very happy to present one of our own, Nilesh Mistry, who's a technical lead and software engineer at Booz Allen Hamilton, where he specializes in designing, building, and maintaining secure and performant cloud-hosted platforms. He has over 11 years of experience supporting NIH, several ICOs, including NICHD, ours, NIDDK, ODSS, and NCI, including supporting us for more than 5 years. Next slide. We also have this afternoon an expert from the RAS team, and he will be speaking more broadly. And Nicholas has 17 years of cybersecurity expertise and identity credentialing and access management within the federal health systems. So I leave it to Nilesh.
Thanks, Rebecca. I think Parker will be sharing the presentation for Nicholas first.
Okay, so Then, Nicholas, can you begin with your presentation?
Sure. Okay. So thank you for the invitation. Well, I'm just going to go through our deck here and talk about RAS, and then some of the cater requirements and exactly what that means. So RAS has been kind of the source for single sign-on for researchers now in NIH for a few years. However, not at the identity and access level, sorry, identity assurance level too, which is what the Cater initiative and then where that comes from. So the Caters are, of course, controlled access data repositories, and because the initiative, the requirements from OCIO are to have an authentication, authenticator assurance level of 2, and identity proofing to identity assurance level 2. AAL2 and IAL2 is what those are, and AAL2 is multi-factor. And then the authorization piece of that is granted via the consumption of GA4, GH passport, and visas. Now, the users that need access to the NIH Caters must complete the identity proofing at IAL2 or IAP high if their existing account was created at a lower identity assurance level. IAP high here is the in-common equivalent of IAL2. InCommon is an identity provider that is coming down the line with Caters, but is not yet integrated with them. If we want to move to the next slide. So this is actually a demonstration of the simple IAL2 level linking between our identity providers, login.gov, and the ERA Commons. That's a feature that is enabled, or it can be enabled rather, for a Cater that allows an applicant to have their IAL level 2 account, either through login.gov or ID.me, linked down to their ERA Commons account, which is not at IAL2. This would allow then the user to log in via their login.gov or ID.me account and have the authorizations from their ERA Commons account. And this demonstration right here will just go through the process of linking that account. And once that's linked, then those authorizations can be brought into the Cater. If we want to go ahead and press play on the demonstration. So the user here will log in with login.gov. They'll go through the multi-factor authentication. And this is from the Cater itself, passing through to RAS, then to login.gov. Then you go in here, you log in with you hit link, you sign in with your ERA credentials. And then that will link your ERA Commons account, your ERA Commons account to your login.gov account there. This is a feature that enables then the use of the ERA Commons authorizations for those IAL2 accounts. This isn't enabled on every Cater yet, but it's a possibility for that if there's a desire for linking. If we want to move on to the next page. So some common questions for RAS here. Why is IAL2 or IAP high required for Cater access? So this is required to be compliant with NIH's stronger identity proofing standards when accessing the Caters. And the reason being is that this allows a user identity to be verified against identity proof from real world evidence. And since it's a controlled access data, this is part of the requirements to protect sensitive research data. And how we meet those as a user, you have to complete identity verification through a supported identity provider, which is currently login.gov and ID.me. And the verification process, which we do have links to, is also that goes into depth for each one of those providers, includes providing identifying information in official documents, sometimes remote or sometimes in-person identity proofing as well. The next one here does cover a little bit more in depth what the identity providers are accepted for IAL2, which is currently login.gov, ID.me, NIH PIV card, which offers an even higher level of identity assurance, and Incommon Federation, which is coming out very soon, actually, for the for another identity provider. For international users, we do recommend ID.me as the recommended identity provider. And another issue that we've been encountering recently is actually if an identity provider user account email doesn't match your caterer or your, in this case, NIDDK-CR for our user account, that we have to have those emails updated. That way the authorizations would be correct, and the identity provider account would actually then correctly log into the NIDDK account. And this does require, and this is an OCI requirement, it does require an organizational or institutional email address to be used with both your identity provider and your NIDDK account. And again, those email addresses should match between the two. And if there's any issues here you're having with identity verification and multi-factor authentication, there is an identity provider support team for both login.gov and ID.me, and we can provide the links to those supports pages as well. Next slide. And this is the links to the URLs here for those support pages that we can provide after the fact. And a little bit more about RAS for both the development and user guide here. The partner developer guide is specifically for those caterers that are looking to integrate with RAS, and that goes into the technical details around user info, passports and visas, and the GA4GH passport or payloads. And then the user guide is a little bit more for the end user themselves for accessing caterers. I believe that's the end of the RAS slide. Yeah, and that's the end of the slide deck for RAS. Do we have any questions?
Yes, we do. Nicole?
Yes, thank you for this update today. I was curious, is there a specific time frame for which all of the caterers, or this is more at the user level?
Specific time frame. Oh, sorry, go ahead.
So in other words, like all of the caterers have this RAS feature?
So caterers are all being integrated with RAS, and they're all in various phases right now, actually. I think out of about 45-ish caterers, we have 14 that are in production. However, all have been in contact with our team and have begun the integration process of some sort.
Okay, and when is that integration due to be complete?
It's phased, so depending on the caterer, it depends over the next year on where they're at. R for R is integrated already with RAS, though.
Is there a list where we can see those that have been integrated and those that are not?
I believe the secure data science team actually tracks that specifically, but we could definitely pull that up, yeah.
Okay, thank you so much.
Sure. Any more questions about the RAS process? Any more background on the RAS caterer requirements, anything like that?
Well, Nicholas, stay here because there may be additional questions. I think we can pass to Nilesh for the next portion.
Yep. Thanks, Rebecca. And Parker, I'll grab the screen. So we just wanted to supplement some of that background information on RAS with the pieces that will be relevant for the users of the NIDDK Central Repository. And we're just starting here on the home page. And for users who have been using our system for many years now, you may have already noticed this change as it went into effect April 1st, the IAL2 identity verification. For those of our users who may not have logged in since then, you will be prompted with those messages the first time you log in. Of course, you'll still log in with the sign in and register button here, but we want to draw attention here to this message at the top where we are talking about the recent changes to the security requirements. And we want to specifically point out our RAS user guide. The RAS user guide is going to help our users not only walk through the RAS and IAL2 login process, but for users who may have had larger gaps in between times, there are other linking, account linking measures that we have implemented over the last couple of years. This document is also going to include helpful information and contact guidance if you run into issues. So I'm actually going to jump to that document. And there's a few bits in here that I highlighted that I wanted to point out to the team today. The first of which, like I mentioned, is since April 1st, if you haven't logged in, you will be prompted to transition your account to IAL2. This is the identity verification. So in the past, we had RAS implemented, but you were able to proceed with just a username and password, plus a multi-factor authentication via text message or authenticator app. In addition to that multi-factor authentication, now all users will need to do a one-time identity verification, and you can use login.gov and you can do ID.me as the two identity providers that support this at this moment. If you are an international user, ID.me is highly recommended as it does not require a social security number. You can use ID.me if you are a US-based user, but you also have the option to use login.gov. During the identity verification process, you will be asked to provide things such as your social security number or driver's license and a phone number, all of which should map back to your identity. This will allow them to verify that you are who you are. And if you're unable to do that over the web, there are options for in-person identity verification, such as going into a post office. Let me go down to the second highlighted bit here. And I believe Nicholas also mentioned this, but for some of our users where there might have been a gap since the last time you were in the system, we also are now in alignment with NIH security requirements that do not allow the use of personal email addresses. So if you had a login.gov account, but you were using your Gmail or your Yahoo account, that will no longer be acceptable. So you will need to create a new account using your institutional email address from your university or your company. And after which you will be able to link your previous information from your previous account that had your personal email address. So your requests and other information will be transitioned over. But this is just a reminder that if you are creating that new identity verified account with login.gov or ID.me, please make sure to use your institutional email. If you've previously used our system and logged in using login.gov, you would have had an account that was at IAL1. And when you do log in with that account, it will appear as a successful login, but then you'll be prompted to switch to an identity that meets the security requirements of the system that you're attempting to access. At that point, you'll be able to keep your same login.gov account. You will just add the identity verification to that same account. Once you complete that, you'll be redirected to the NIDDK Central Repository System, and you will see all of your previous account information and requests and other things. I know we have some users on the call, so we'd like to open it up to questions on any users who are having difficulties in logging in to the application using an IAL2 identity provider via RAS.
Please feel free to unmute or write it in the chat. So we have a question. Does R4R also have an interface for the requester signing official, or is that not an option? Nilesh?
Yeah, so for all of our data requests and specimen requests, the signing officials do not need to register in the system at the moment. They will receive their DUA or MTA documents via Adobe Sign, and that is where they will attest to all the requirements and terms and conditions in order for the request to proceed.
Sounds like that answered the question. Anyone else from those present here today? In the interim, Nilesh, do you have any use cases that you want to discuss that perhaps we want to bring up and maybe others have the same experiences?
Yeah, sure. So we of course talked a little bit about the linking accounts. Of course, if your previous accounts were using a non-institutional email address, and that's also documented further in our RAS user guide. Something that we've been noticing as we continue to support our users during this transition is during the identity verification process, we do have some users whose phone numbers are not successfully being verified. And one of the key details that's included in the login.gov guidance and helpful information that is often overlooked is these phone numbers cannot be the voice over internet protocol or VoIP phone numbers. These are often provided by our institutions as they provide them as work phone numbers to the entire institution. It's not obvious that they are that kind of phone number, but they're not tied to an individual user at the billing level. So the systems behind the scenes are unable to verify that this phone number actually belongs to that individual. So this is where you would need to use a landline number if you have one that's registered to your name, or a cell phone number that's registered to your name. If you're unable to provide a phone number that is registered to your name, this is where the in-person identity verification option would be presented, where you can go into a post office and provide different kinds of documentation to prove you are who you are. You'll receive an email address if you just, you'll receive an email to the address that you're registering with, if that's the option you decide to proceed with. That content of the email, that letter, is what you'll need to take to the post office, and that'll allow them to understand what you're trying to do, who you're trying to verify yourself as, and they'll also allow them to close out that case from their end so that you can continue within the system with your identity being verified.
Thank you, Nilesh. I know that we have had quite a bit of users reach out with some of the concerns. Anyone else with additional questions from those present? I don't hear anything, but from the RAS team, do you have any additional advice for those that are here or those that will be listening to the recording later on?
I think we covered it. Just wanted to make sure that, if there's any follow-up, please reach out to our team or the user guide and the dev guide as well. Those links are very helpful. Plus, for end users, the identity proofing process between login.gov and id.me, the links for those are very handy.
Thank you. Nellis, can you confirm that we do not use ERA Commons as well?
That is correct. At this point, because ERA Commons on its own is not at an IAL2 security level, that's no longer available as a login method. However, as shown in the demonstration from Nicholas, if you do have an ERA account, there is a way to link it to a IAL2 identity, allowing information from your ERA account to funnel through when you do log in.
Well, I don't see any comments in the chat or raised hands either. So if there's no additional questions or comments from those present, I think we can adjourn early. I think before I let everybody go, if Parker, you can put the slides back and remind everybody that please, we have a poll here. If you could please respond, this helps us set up next meetings. So if you take a few minutes to respond, this will help us select topics. Also, if you can join us next time, this is a reminder for our next month's session. It's going to be on the NIDDK-CR for our workbench. We're going to have a demonstration on the available tools. So join us next month. Thank you again.